Hey everyone, this is Dr. Jamie LaViola with Dental Masters of Alexandria, and today I want to speak to those of you that may have been hesitant or are hesitant to get dental work or get your teeth fixed because you are concerned that your teeth may come out looking fake or overly white or possibly like chiclets. You know, you've seen them before, straight, perfect, rectangular white teeth that sometimes look fake. So today I'm going to show you a patient that had those exact same concerns and how we worked together to address those concerns to give her the natural smile she was looking for. So this patient had been seeing us on a regular basis, and finally one of her front teeth chipped and broke, and really the front 6 teeth were all pretty worn down. So she came in and we fixed the tooth with some filling material just to kind of get her through that day. And that's when we took our records and discussed with her what the plan was. Starting off, doing an intraoral scan, which captures the current condition of her teeth and her gums, so I can send that off. We also did some facial scanning. We merged those files. We sent them off to a CAD/CAM designer, one of our teammates. And as you can see here in the pictures, this is the digital design, true to scale, by the way, of what they came back with. And as you look at the picture, the teeth, they're a little short. The patient always had short teeth her whole life and didn't want to lengthen them. We definitely can do so. And as you notice, there's also a small space in between her front 2 teeth. It's called a diastema. Some people, including this patient, liked that space and wanted to keep it. And because we're not lengthening the teeth, they would have looked too square anyway. So again, she wants something that she used to look like. She doesn't want to create a new smile. This is the design we came up by taking the records. So let's go ahead and move to the next step. We take that design and we do any preparation to her teeth to get her ready. We scan that. It goes to a laboratory, and the ceramic crowns, in this case, super thin jacket crowns, basically thin ceramic, came back. And let's go ahead and take a look. So here we are, day of delivery. Right now we're trying the teeth in, and again, the color's a little darker. That is what the patient chose for the color. You can see the teeth are really dark underneath, so we're not making them quite as dark as they were. Putting the teeth in, trying them in, making sure we're going to check that the teeth fit onto the margins of the existing teeth well. So in other words, they blend well. We will be checking here to make sure the floss goes through properly. And as you can see, the space is still there, just like the design. The teeth look almost exactly like the design. And of course, the gums are a little irritated. That's because we use a little tiny, what's called a little tiny retraction cord when we're cementing them to make sure there's no moisture. So they look a little funny right now. But I really wanted to show you the teeth, how fast they go in, by the way. And that's what they look like. So this is try-in. After this step, we went ahead and went through the process of bonding them on permanently so that they are not going to come out of her mouth. So there's a little bit about our process of how we start with taking records, sending them to our CAD/CAM designer, working as a team, and all the way to where you see the teeth being tried in, verified that they look like our design, and ultimately cemented permanently in place onto the teeth. But more importantly, I am not here to dictate and tell you what your teeth should look like. I will give you recommendations based on my 20 years of expertise and experience on cosmetic dentistry and how the bite should fit together and so on. But this is more of a collaborative effort where you and I will sit down and you actually get to see the teeth before we even start the process, and then kind of work through the process and get to that end goal and give you a custom result. If you want the teeth a little darker, great. If you do want them Hollywood white, great. We can do all that. But again, it's a collaborative effort where you and I are going to sit down together and give you the smile that you desire. So once again, this is Dr. J with Dental Masters, and let's go ahead and set up that consultation so we can give you that custom smile that you desire.